Hello, this is my perio case study on my patient, Mrs. Yelnats. Mrs. Yelnats is a 61-year-old Caucasian female. Her chief complaint is that she hasn't had a dental cleaning in over 20 years. Her occupation is as a registered nurse and certified midwife. She states that her job is extremely stressful as she deals with worrisome mothers-to-be for over 80 hours per week. She states that she delivers about 6 to 8 babies per week, some of which are born premature. The medications that Mrs. Yelnats is taking are losartan for her hypertension, sertraline for her depression, and Bayer for heart health. Ms. Yelnats is 5'5". She weighs 215 pounds. Her blood pressure at her initial appointment was 140 over 100. All other vital signs were within normal limits. She was hospitalized in 2019 for a concussion sustained from a headbutt from her husky. A CT scan was also taken during her hospitalization. She is ASA level 2 due to her hypertension and her depression. Mrs. Yelnats has had all of her wisdom teeth extracted under local anesthetic. She says that she brushes her teeth twice a day with a medium toothbrush. She flosses at least one time a day or whenever she has food debris stuck in her teeth. She claims that she eats out more than 5 times per week due to her hectic work life, and she admits that Diet Coke and everything chocolate are her guilty pleasures. Upon her extra-oral exam, I did find that Mrs. Yelnats had deviation of the TMJ upon opening on the left side. Her extra-oral exam showed that she had Fordyce granules on the upper and lower lips, bilateral linea alba, bilateral mandibular tori, as well as palatal tori. Her hard tissue exam showed that she had 28 teeth, attrition of teeth numbers 8, 9, 21, and 24, yellow extrinsic stains on teeth number 8 and 9, and all posterior teeth, class 1 occlusion on both right and left sides. She had a midline deviation of 2 millimeters to the left and overjet of 4 millimeters. She had healthy periodontium with 142 readings of 1 to 2 millimeter pockets and 26 readings of 3 millimeter pockets. These readings were accompanied by bleeding points localized to teeth number 24, 25, and 8 and 9. Her gums were pink and healthy. The contour of her gums was pointed. The consistency was firm and resilient. Her texture was stippled and healthy. And again, she had localized bleeding upon probing on number 24 and 25. At Mrs. Yelnats' second appointment, her plaque score was 12.5%. At her third appointment, which was her last appointment, her plaque score did drop to 8%. So we have about a 4% drop, so now we are under 10%. Mrs. Yelnats did have some yellow extrinsic staining on teeth 8 and 9, as well as some yellow and brown extrinsic staining on the interproximal areas of her lower anterior teeth. She did have several amalgam restorations on the occlusal surfaces of her molars and her premolars, as well as moderate sheath calculus on the mandibular lingual anterior teeth. These are Mrs. Yelnats' radiographic findings. She did have healthy bone level, amalgam restorations on teeth number 4, 5, 1, 13, 18, 20, 28, and 31. She had composite restorations on teeth numbers 2 and 3, 5, 14, and 15. Active caries were found on teeths number 3, mesial distal, 4, distal, 21 occlusal, and 29 distal. Her diagnosis was mild gingivitis and her calculus type was type 1. Now, although the patient does brush her teeth 2 times a day, she does use a medium toothbrush, which can cause abrasion of the teeth. She flosses her teeth once a day and she also uses a mouth rinse once a day. So we're trying to get her to bump it up to 2 times a day. She eats citrus foods frequently and she also drinks Diet Coke daily. As stated before, anything that's chocolate are her guilty pleasures. She did have moderate supragingival sheath calculus on her lingual anterior teeth, and she does have hypertension. Her blood pressure at her first appointment was 140 over 100. What we implemented was a prophy. I hand scaled all the calculus to subside her gingivitis. I provided her with OHI. Her plaque score was lowered from one appointment to the next. I deplaqued her teeth with a prophy angle and prophy paste, provided her with nutritional counseling to prevent caries on her other teeth, and I did apply a topical fluoride varnish to her teeth, and I put her on a 6-month recall. I did refer Mrs. Yelnats to a dentist in her local area to help treat her active caries. Mrs. Yelnats' prognosis with treatment is good. She has very healthy bone level. Although she's at high risk of caries, she is motivated to keep her mouth in working condition. Without treatment, her prognosis is fair, as she is motivated to keeping her mouth as healthy as possible. As references, I did use the TSTC Dental Hygiene Clinic Manual, as well as the Wilkins Bible, the clinic practice of the dental hygienist, and I used Google Images for the images on my slideshow. Thank you.